How's it going, guys? Medium difficulty question for endocrine step 1 internal medicine 2 CK. 31-year-old woman. She has a follow-up appointment. Serum studies show sodium normal 140. Should be 135 to 145. Potassium elevated at 7 should be 3.5 to 5. Calcium low 8 should be 8.4 to 10.2. Phosphorus elevated at 6 should be 2.5 to 4.5. Bicarbonate low 20 should be 22 to 28. I know some of you watch this clip say, well, I don't know the normal values. I would normally have those available to me on the exam. You got to take your fucking training wheels off, okay? Stop your whining. Stop your crying. Which the following most likely be seen in this patient? Choice A, adrenal atrophy, wrong fucking answer. So even if we wanted to think e.g. autoimmune disease such as Addison, where we have attack of the adrenal gland, and that would absolutely result in an elevated potassium, decreased bicarbonate. I talked about in the last YouTube clip that in about half of aldosterone derangement questions, sodium can be in the normal range. Okay, so this isn't abnormal. This isn't abstruse if sodium were to be seen in the normal range in an aldosterone derangement question. So the normal sodium, the high potassium, low bicarbonate absolutely could be low aldosterone. There's only one problem, which is that doesn't explain our low calcium and high phosphorus. So we clearly have other stuff going on here. Wrong fucking answer. Choice B, adrenal apoptosis, wrong fucking answer. So me being a flagrant asshole here, and that just threw in a distractor, okay? If you weren't sure, if you thought this were adrenal related, that's how some students think. They get caught up in, OMG, is it atrophy or apoptosis? It's got to be one of them. Wrong fucking answer. Choice C, hypoparathyroidism, wrong fucking answer. So, well, calcium low, phosphate high, sure, absolutely. That could be hypoparathyroidism. The only problem is that we have bicarbonate potassium derangement, which wouldn't be explained by hypoparathyroidism in isolation. So we raise an eyebrow to it, but in this case, wrong fucking answer. Choice D, osteomalacia, correct answer. Now, it's going to be slightly weird if you didn't know that the diagnosis here is renal failure. Okay, so osteomalacia is vitamin D deficiency in adults. It's called rickets in kids. Well, this combination of values is high yield for renal failure. You need to know that sodium can be variable, can be whatever the fuck it wants to be in renal failure. So potassium's always high, calcium's always low, phosphorus is always high, bicarb's always low. Okay, it's part of mud piles. Uremia means renal failure, okay? So it's part of mud piles, high NINGAT, metabolic acidosis, and you're gonna have increased phosphorus and decreased calcium. Really important you know that. So there's two reasons why calcium's low in renal failure. The first is that the late DCT of the kidney normally reabsorbs calcium. You can't do that in renal failure. The second is that we normally have 1-alpha hydroxylase activity in the PCT under the action of PTH, converting inactive 25 into active dihydroxy 125D3, the latter going to the small bowel, increasing calcium absorption. Well, we can't do that either. So calcium's low in renal failure. Decreased negative feedback calcium sensing receptors, parathyroid glands, PTH goes up to compensate, okay? So that's called secondary hyperparathyroidism. Now, the low vitamin D is what we call renal osteodystrophy when it causes bone problems, okay? So the low vitamin D, and then they can say anything miscellaneous. They can say she's got a problem with her hip, pain in her hip, okay, and that's going to be a pseudo fracture of the femoral head. I've seen that in USMLE question, and then the answer is decreased intestinal calcium absorption. That connection can be difficult if you don't understand the endocrine. Well, I mean, if you have low vitamin D in the setting of renal failure, you're going to have decreased calcium absorption from the intestines, okay, and osteomalacia, vitamin D deficiency. Pseudofracture is a buzzy term for vitamin D deficiency. So let's just quickly look at the other answer choice here. Parathyroid adenoma, wrong fucking answer. So if this were the case, we have primary, not secondary, but primary hyperparathyroidism. Our calcium would be high, phosphorus is low, okay? So you need to know that in primary hyperparathyroidism, high up arrow calcium, down arrow phosphate. But in secondary hyperparathyroidism, which just means renal failure, we've got a down arrow calcium, up arrow phosphorus. So the arrow's the opposite here. So important constellation of arrows, which I harp on in my high yield arrows PDF, which by all means I'll link down below. You need to know this combination for USMLE. You know the deal. Make sure you make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.